Hey, it's Dr. Troy here, Zenaptic Chiropractic. I want to talk about spinal decompression research. You know, there's a lot of people out there who are suffering. They estimate that over 2 million Americans right now are suffering from severe low back pain. And so what do you do for that? You know, the traditional approach has always been massage, acupuncture, traditional chiropractic adjustments, pain meds, cortisone shots, and even surgery. And in my case, I injured my low back, had an MRI, I found that I had 2 disc bulges and an annular tear. And I was doing the acupuncture, I was doing the massage, I was doing the chiropractic, I was getting adjusted all the time. Nothing was helping. So I was like, what do I got to do? So I actually found a doctor who works with Zenaptic Chiropractic. I found a doctor who actually took care of me. And within about 2-3 weeks, I was pretty much fully functional. 90% of my pain was gone, and it was pretty amazing to me. So I said, I'm going to buy one of these machines because I've had patients in my 25 years that, you know, the traditional stuff didn't get them to where I think they could have been. So I added this adjunct to our office, and here's what some of the research is showing. They say that Stanford and Johns Hopkins University say non-surgical disc decompression versus motorized traction. So they compare the two. And motorized traction, things like inversion table. So with decompression, it actually focuses on the disc. And what they found, that 77% up to 86% of the people who did a series of disc decompression treatments had reduction in their pain symptoms. Georgetown University looked at 50 patients, a mixture of women and men, and they looked at non-invasive treatments for lumbosacral, so low back radicular pain, so pain into the legs, numbness, tingling, sciatica type things, even paresthesia, altered sensation, and even sometimes we'll see changes with reflex that can improve, or even foot drop. So these things may be able to be helped, but what Johns Hopkins found is that the average person had low back pain for at least 2.6 years. The shortest duration of back pain was 3 months. The longest patient that was in this study had low back pain for 15 years. So I can't tell how many times I have people come to our office, they've been in pain for 5, 10, 15, 20 years, and no one's ever shown them a way to feel better. And so what they found at Georgetown on their study, the average of 57 days, the patient was 86% back to normal activities of daily living. So in less than 2 months, that 86% of the patients had their normal activities of daily living back. What would that mean if you can't golf or garden or ski or hike or play with your grandkids because of severe debilitating back pain? I mean, I know what that's like, you know, not, hey, don't, my kids would always say, Dad, pick me up. And I'm like, I can't, my back hurts. My wife's like, get off Dad, because his back hurts. And so now I'm able to pick my kids up. So really, it's a true miracle when you can really help people that have been chronic back pain sufferers recover. One more thing, in the Journal of Neuroimaging, they found that 25 to 100% of the disc herniations reduced post-MRI. So what that means is after disc decompression treatment, their disc herniations were on the post-MRI were actually improved, some of them up to 100%. 10 out of 14 of the patients were 90% better who had disabling pain, which was affecting the quality of their life. And they also found out 85% of the patients studied, they were improved clinically, and there was a correlation with improved MRI findings. So it's amazing to me. Also, the other thing is they did a study with DRX outcomes. They looked at 219 patients. 86% of the patients had complete resolution of their pain. I don't know about you, but if you're looking at back surgery there tends to be a high failure rate, meaning you have a discectomy, for example. The problem may come back in 3 to 5 years. And that's what they're showing, that about 85% of back surgeries fail in 5 years. So what's that mean? You're back for another surgery. So if we can show people a way to help avoid surgery, help avoid the medications, get their life back, that's really what it's all about to me. And sometimes there's people that definitely do need surgical procedures. But this is an alternative to doing that. And if it works, and what the studies are showing, that a majority of people are getting significant relief with using spinal disc decompression. So if you're interested in getting checked out, having a consultation with one of the doctors at Zenaptic Chiropractic, call the office, 260-6903. That's 360-260-6903.